Hello, everybody. Angelica Olea here, the Senior Vice President of Operations with Assisted Living Locators. And I am excited to have All About Alzheimer's live stream today with you all, providing families, caregivers, and healthcare professionals with practical advice and real-time answers on Alzheimer's and dementia care. Today, our episode is Managing Alzheimer's and Dementia Health Concerns, Practical Solutions for Caregivers. Today's episode, we will aim to provide caregivers with effective strategies for managing health and behavioral challenges that accompany Alzheimer's and dementia. I would love to invite our viewers that are joining us today to ask any Q&A. And at the end, we'll go over any questions that you have. This is being monitored on Facebook and YouTube, so please be sure to submit your questions. And at the end, we will go over those. I would like to introduce our guest today and have them give a brief introduction of themselves. And our first participant is Mary Zabian. Welcome, Mary.
Thank you. I'm Mary. I'm a senior care advisor in the greater Boston area and in Rhode Island. I've been helping families for about 8 years now, and most of my background is on the assisted living side, helping families transition, and I've owned assisted living locators for about 3 years now.
Awesome. Thank you for joining us, Mary. And next we have Tracy Duff.
Good morning or good afternoon, I guess, right? Thank you, Angelica. I am a dementia care certified senior care advisor and owner of assisted living locators here in Plano, Texas. And I got into this business and found my passion after being the advocate for my Mima and both of my parents and being their caregivers, knowing how extremely overwhelming and stressful this time can be. I love guiding my seniors and families through this journey into dementia care and senior living.
Wonderful. Well, thank you both for joining us today. And I'm so excited for our topic that we're going to be diving right into here next. So our first topic we're going to discuss is understanding key health challenges in Alzheimer's and dementia. So Tracy, are you able to describe some common cognitive and behavioral challenges that we see in Alzheimer's and dementia patients?
Yeah, most definitely. Dementia is a broad term, and it refers to the decline in mental ability that is severe enough to interfere with daily life. So not just a single disease, but rather it's a set of symptoms that can be caused by a variety of conditions and diseases such as Alzheimer's, vascular dementia, dementia with Lewy bodies. So these people, they may struggle with their short-term memory, like forgetting recent conversations, misplacing everyday items, or even having a hard time recalling what they just had for breakfast. They can become disoriented in what time it is, where they are, what season it is. While some distant memories may remain intact for a while, eventually a person may start having difficulty recalling significant past events and familiar places, or have trouble recognizing acquaintances, or even misidentifying family members. Through all this, they can also experience personality changes, mood swings, start wandering off. Because they're anxious or looking for something or someone familiar. They might be looking for home, and that home could be their childhood home. So it can be very difficult. And the personality changes make it really difficult on family and friends to communicate effectively, and can lead to misunderstandings in the social settings. So as our brains cells get damaged, those everyday tasks like bathing, dressing, or managing medications gets much, much harder. So repetitive questions, getting lost in familiar places, and difficulty keeping track of bills and appointments can be major frustrations and anxiety for the dementia person and the caregivers.
Absolutely. No, thank you so much for that. I know that's definitely one of the first things that we see and begin to notice are those personality and behavioral changes. No, thank you so much.
Yeah.
Mary, what about physical health concerns?
Yeah, so I think Tracy did a great job really highlighting what we usually think about when we think of dementia and Alzheimer's, which is your cognitive changes. But it can also have a really big effect on our physical body as well. And as the disease progresses, you'll notice mobility is becoming more and more difficult. Walking slows down. This can be caused by side effects of dementia medication and other medications, a mix of our other medical conditions. Strokes can be really common in dementia patients, vision loss, and of course, balance issues and just general discomfort in our environment. When you're feeling confused and disoriented, it can make us feel really unsafe kind of moving around. So we start to become more sedentary. Um, with this, we become obviously weaker, our muscles become stiff, and this can lead to more physical symptoms of dementia. And this can present things like loss of balance, shuffling, um, fatigue, and difficulty controlling our bladder and bowels, which can be really tough on families. We also start to have a weakened immune system, an immune response when we suffer from dementia. So this puts us at a much greater risk for infection. And infections can really speed up the progression of some of the cognitive and physical changes that we see. So if you start to notice sudden changes in your loved one, it could be something as minor as a urinary tract infection, but if it's not treated really quickly, it can be really disruptive and dangerous.
Thank you so much, Mary and Tracy. Yeah, the cognitive, behavioral, and physical changes that impact our loved ones that have that is just so interesting to see all of those. So I do want to mention again that if anybody has any questions, please feel free, if you're on Facebook or YouTube, submit those questions. And at the end, we'll be sure to go over those questions during our live Q&A session. So let's talk now, Tracy, practical solutions for managing health concerns. Can you talk a little bit about coping with these behavioral in these changes that happen?
Yeah, when dementia leads to agitation and aggressiveness or wandering, keeping calm and a reassuring approach is your best bet. Although it can be challenging for us as caregivers. First, we need to focus on creating a safe space, removing a lot of clutter, using locks and alarms so they're not wandering, and even color coding and labeling rooms and areas of frequency can help with keeping their orientation intact. When the agitation does flare up, again, gentle reassurance, keeping your voice low and steady, get down to their level. Don't look down and talk down to them, maintaining eye contact. And if it's welcome, to give a comforting touch to their hand or shoulder can also be quite comforting and reassuring. Looking for things that might be causing the discomfort. Is there a lot of noise going on? Is there a lot of clutter that can be confusing? Are they hungry? Do they need to use the restroom? Removing those triggers can definitely lower their agitation. And then always look for the redirection, engaging in a simple positive activity, including music, or introduce their favorite snack, or simply shift the conversation to something more comforting. Consistent routine is huge. Keeping meal times and nap times and activities on a predictable schedule lowers their anxiety, and then they know a little bit more what to expect. And just like any of us, validate their feelings. Sometimes simply acknowledging that they seem upset or worried, like saying, "I can see you're upset. Let's just sit together for a moment," can help them feel heard and understood. A project that I'm involved in called the Grandbaby Project, we offer a unique way to ease some of these behaviors by bringing the different generations together, babies and seniors. The babies spark meaningful interactions and reduce stress foster connections and give that person a feeling of purpose, and can tap back into those happy memories of childhood or when we were parents ourselves. So each person is a little different, so it may take some experimenting to see what works best, but always using a calm, patient, flexible approach can make the biggest difference in reducing that agitation.
Thank you, Tracy. I love that grandbaby project. That's amazing to see that. So let's dive into supporting daily hygiene and health maintenance. So we know that this can become challenging for those that are diagnosed with Alzheimer's to really maintain their daily hygiene. So I'd like to talk about some things that you can do to support these daily hygiene and health maintenance. So make sure you're establishing that routine and breaking down these tasks into bite-sized, easy, digestible pieces for them, really helping simplify this. And while doing so, you need to ensure that we're maintaining their dignity and privacy and make it as comfortable as possible when working with them, and just be patient. That's the main thing. Be patient, flexible, and if you need to switch it up, try testing different things out that will work with them. But it's really important to make sure that you try and be consistent with whatever routine you do feel is working best, and break down the steps. And okay, let's grab the toothbrush. Where's the toothpaste? Let's put the toothpaste on the toothbrush. So really breaking it down into those easy to understand pieces. And next, I'd like to invite Mary back to join us to talk about promoting some of these physical activities and how that affects their mobility.
Yeah, so obviously exercise is really important at any phase of our life, but those with Alzheimer's and dementia can benefit really greatly from a regular exercise routine. Some of the benefits we see in our seniors that are more active, they have improved mood, better sleep, maintenance of motor skills as the disease progresses, reduced falls because of an improved strength and balance, and also reduced rates of wandering and agitation and aggression, which can be really helpful when caring for someone with dementia. Most seniors are not used to a kind of structured exercise routine, going to exercise classes and whatnot. So we want to think about exercise as anything that gets our heart rate up. A lot of our partners offer classes that you can take online, and we'll show that in our downloadable guide at the end. But even just walking, introducing a task that can give a senior some kind of purpose, walking to the store to get milk, walking to the post office, or even just walking to the mailbox to check the mail. Things like doing housework, laundry, yard work, anything that can get them up and moving and also give them a purpose, I think is really helpful. And we really want to make sure we're adapting the tasks for any phase of dementia. Sometimes seated exercises are best as the disease advances. But if someone can get up and move, we want to empower them to do that, because if you don't use it, you lose it.
Definitely, absolutely. It's so important for everybody just to stay physical, and as we age, even more so to maintain being able to walk and move our arms. And I love that suggestion you gave that in the later stages, doing some sort of chair exercises. So thank you for that, Mary. And please be sure submit your Q&A on Facebook and YouTube so we can go over those questions here at the end. So Tracy, what about preventative measures? Can you list some common health risks and how we can improve or try and stay away from those things? How do we prevent this?
Yeah, I'm big on prevention. Falls are big. We've really got to do our best to keep the hallways and walkways clear, removing throw rugs and cords. Walkers' feet can get caught on those cords really easily and cause a fall. Proper lighting, making sure the hallways and the stairways, bathrooms are all well lit. The motion detected night lights are wonderful, especially for those that get up during the night. Supportive footwear, I can't say this enough. No more flip-flops, no Crocs. We need good, solid shoes with good support and no slip bottoms. putting handrails, not only in the bathrooms where we expect it, but along the staircases and long hallways can even have a chair rail with a lip on it for guided support as they go through those hallways. And another major thing that we see a lot is dehydration. And I think we all need to remember that we need to drink, but for our dementia patients, they forget. They don't realize that they're thirsty. So we can't wait for them to ask us for something to drink. We need to offer it more often, even by placing water bottles around at their frequent areas, whether it's in their bedroom, in the TV room, in the kitchen. So there's always that water and beverage available for them. And making it flavored, change it up a little bit, have some iced tea or no sugar juices. That can help too and make it a little bit more appealing. The visual reminders, just having a water bottle out helps a lot. Malnutrition, simplifying the meals and making it more often as opposed to the 3 big meals a day is huge. Keeping an eye, as caregivers, keeping an eye on their weight and changes with that, and notice if they're having any issues swallowing or chewing, because that can be a negative feeling for them and not wanting to eat. Creating a calm setting, reduce distractions, maybe turning off the TV while eating if that gets them distracted, and keeps them to be able to focus on their meal a little more. And always incorporate their favorite things. Throw some French fries and ketchup on there to help keep the consistent eating going. That can be a big help. It helps me. I'm all about the French fries.
Love that. And so, Tracy, what about some resources for those that are caregiving for loved ones with Alzheimer's or dementia?
Yeah, there's a lot of support groups online or in person. I'll touch on a few of them here, but there will be a list in our free downloadable resource guide. But the Alzheimer's Association offers local and in-person support groups all over the United States. Facebook has a big, large, active community called Memory People for caregivers and individuals affected by dementia. And they do a lot on their experiences and tips and tricks that they've tried that have worked or not worked. And of course, your local hospitals and senior centers always have a good list and may provide some stuff on their own.
Wonderful. Thank you, Tracy. And as Tracy mentioned, at the end of this live stream, we will be sharing a free downloadable guide for all of you that have all of these resources that we have talked about today. So please be sure to check that out. And Mary, I'd like to invite you back to talk more about some useful technology and tools that can be helpful for those.
Yeah, so there's a lot of online resources now with YouTube and everything and all the technology we have. You can take advantage of a lot of exercise classes. I've included some in our guide here if it's something you want to do at home. We also have some really great monitoring devices now and medication reminder technology, so they can help to kind of streamline the caregiving at home, tracking, when someone takes their medication, falls, movement. And I also really recommend going to your local YMCA or senior center and participating in some of their exercise programs as well.
I love that. And something that you brought up is the monitoring tools, and to be able to, if you're not next to your loved one, being able to see and monitor if they are to have a fall or if something happens, having that view on them. That is so amazing that we've got that technology now that most people probably aren't tapping into. So be sure, for those that aren't tapping into that, check out our free guide that we'll be sharing with you all. Let's see. And then at the end, we'll share that free link that you can check out. And for immediate assistance, you can always, like Tracy said, go to your local hospital, check out your local Alzheimer's Association or area agency on aging if you need immediate assistance or help. Let's jump over to our live Q&A. So Thank you so much, Mary and Tracy, for going over such valuable information today. This was awesome. So I know that we're already getting some questions in. And for those that do have more questions, please be sure to submit those on Facebook or YouTube, and we'll go over those questions. But the first question that we do have is for Tracy. So Marcy from Chicago asks, what are some effective ways to respond when my loved one with dementia experiences hallucinations or insists that her false stories are real? I know we see this all the time, Tracy.
Yeah, I have lots of stories on that as well. First thing, and sometimes the hardest thing, is stay calm and reassuring. Don't argue with them and try to correct them. At this point, you can use a distraction, redirection, get the snack, going through pictures. And again, go back and check for the triggers. Is there clutter? Is there a picture or a mirror or something that is triggering that hallucination? And you're not here to do this on your own. You can always seek professional input. Sometimes a medication adjustment or other interventions might be able to reduce the symptoms. And back to maintaining a routine. Keeping those predictable daily schedules and familiar surroundings can take a lot of that stress away.
Yeah, absolutely. And something that you said is don't argue. I know that that's where a lot of us catch ourselves, wanting to argue back with them. No, no, mom or dad, no one is stealing from you. You misplaced it or you didn't put it where you normally did. So I know that's definitely one of the struggles that many caregivers or those that are dealing with someone with Alzheimer's or dementia face. So thank you. That was wonderful. Let's see. So our next question is going to be for Mary. So Ron from Columbus, Ohio asks, how can I take advantage of physical therapy or occupational therapy at home?
Yeah, so we want to make sure that we're taking advantage of our Medicare benefits however we can. You can always private pay for physical therapy and occupational therapy from a local skilled home care provider. But if you speak to your PCP, your primary care provider, and talk about some of the changes you're seeing in your loved one's mobility, oftentimes they can find a compelling reason to have outpatient services covered by Medicare Part A. Also, Medicare Part B does cover things like some fall prevention programs and other kind of ongoing strength training services. So you'll want to talk to a skilled home care agency about some of that and what the options might be.
Wonderful. Thank you so much. Yeah, that is such a great service. If you can bring that in home and you don't need to necessarily go out and do that, that is wonderful. So I'd like to thank Tracy and Mary for joining us today. And I would like to invite them to share their contact information with you. So if you have any additional questions after this, please feel free to reach out to our wonderful attendees today, Tracy Duff, if you would like to share how people can get a hold of you.
Yeah, so I am in the Plano, Texas, Dallas area, and email is Tracy, TRACID, at assistedlivinglocators.com.
Wonderful. Thank you, Tracy. And Mary, how can people contact you?
Yeah, feel free to also reach out to me via email. My email is maryz@assistedlivinglocators.com.
Wonderful. And we will be sharing Tracy and Mary's contact information in the comments on Facebook as well, so you can check that out after. And if you'd like to be the first to know about our live stream events, please be sure that you register, and we'll drop the link in the section of each of our platforms that we're streaming on today. If you already received an email about our live stream, then you're already registered, so you're good to go for the next one. This live stream will be available for playback anytime on our website, assistedlivinglocators.com, or in any of the Assisted Living Locators accounts on Facebook, YouTube, and LinkedIn. And again, I want to thank you so much for Mary and Tracy for joining us today and sharing these valuable insights, along with all the resources that you provided to all the viewers today. So thank you both so much. And for those that are joining, thank you for watching, and be sure to grab that free downloadable resource guide here. And you can find that at assistedlivinglocators.com. Please be sure to sign up for future live streams as well. Thank you, ladies.
Thank you.
Thank you.